Hi, Tess with Friends of Flow, talking here today with Frankie, and we're talking about how can nurses use inclusive language, or any healthcare professional, in taking a patient history?
That is a great question. And one of the first things that you have to do is look at your own assumptions. And that sounds like a lot of work, but it's just realizing the things that you assume when you're interacting with a patient. Easy example is that we often assume if a woman is married, that she's married to a man, or that a man would be married to a woman. And so when we interview the patient, we make assumptions like, oh, what is your husband's or wife's name? Depending on the perceived gender of the person we're talking to. And so a lot of it comes down to just thinking about how you do your history and trying to adjust your wording just a little bit. And this is not you have to do it perfectly it's a practice thing. We all were taught from a young age that certain things go in certain boxes. And so rearranging those boxes or throwing them out takes practice and time. So it's not something where you have to have everything perfect to start with. A couple quick things that you can do with the history with the patient, especially when we're talking about relationships or social history, just asking the patient their pronouns. If they're asking about relationships, not using gender terms, asking about partner or spouse versus husband or wife. When you're talking about sexual relationships, not assuming what the patient's behavior is, and making sure that you're communicating a lack of judgment when you're asking those questions. It all comes down to how can we make patients feel more comfortable, because if people are comfortable, they are more likely to listen. They're more likely to feel safer communicating the actual problems that are going on, and we're more likely to build a rapport, and so they'll keep coming back. So it just ends up with better care.
So you're going to have to give me an example, Frankie.
Yes. So one of the statistics that sticks out to me, specifically, let's say with transgender patients, is we have research that shows about 40% of transgender people attempt suicide at some point in their life, which is 9 times the national average. One of the things that we found fairly recently is that statistics drops to below the national average if the parents or support system are neutral or respond positively. So even if the parents aren't jumping up and down with joy, just a neutral response from the people around them can save kids' lives. So part of the way to do that is to be open about asking those questions, treat those questions as normal, and explain it to people. I am absolutely sure that if you ask there's going to be a point, if you ask pronouns, somebody's going to be like, well, of course I have these pronouns. Why do you ask? And then that's an opportunity to be like, oh, we just want to make sure that we're providing the best care to our patients and making sure everybody's being addressed in a way that makes them comfortable.
A trans man, a trans man comes in and is having a urologic issue.
Yes. Mm-hmm. So with trans people, the first part of the word trans means that they're transgender, and then the second part tells you their identity. But that doesn't tell you about their biology. So as a healthcare provider, you in the urology clinic, you would say, there's some questions I need to ask specifically related to your anatomy so I can provide better care. Are there certain terms that you would prefer I use or didn't use that would make things more comfortable, or certain ways that you would prefer to be touched or not touched? So just simple requests
that anybody would want, really.
Yes, which is we do with patients normally.
Right.
Of course, I hope everybody asks the patient at urology clinic what is okay to say and what is not,
and to touch and not touch.
Exactly.
Correctly. So, but a trans man will be on hormones.
Maybe.
Okay, maybe on hormones, which might be new to the nurse. Let's even say that they're an inpatient nurse.
Yeah.
And the trans man is having some sort of procedure or something, and is on hormones that's different, and they're unaccustomed to that. How would that nurse talk to that patient particularly? So
one of the great things, especially nowadays, is there's a ton of resources out there if you have specific questions of is it okay if my patient takes X medication while on hormone treatment? There's a ton of resources out there. One of the things I try to not do is put the burden of all the education on my patient, because they don't feel well. And when somebody's not feeling well, then asking them to be experts in a medical environment is very unreasonable and often an expectation that trans people have to live up to. And this is not a blanket rule, but a similar way to think about it is if you said a trans man, let's say that person is on testosterone and has been for a while, and their hormone levels will be similar to that of a cisgendered man or somebody who was assigned male at birth. Would you ask that patient about his testosterone production?
Right.
And so if you wouldn't, it doesn't make a lot of sense to ask the patient.
Just to satisfy your own curiosity,
exactly.
Or to explore things more.
And being curious isn't a bad thing. The world is interesting and weird. And I don't think there's anything wrong with being curious, but realizing the place that curiosity should be expressed. There's a lot of information that you can find if you're curious about surgeries or medical interventions, but asking your patient specific questions about their genitalia when it doesn't matter to what you're doing, it's wildly inappropriate and could make them really uncomfortable.